While we're keeping you healthy, the flu season is here and with a vengeance. New cases are popping up all across the Mid-South in much greater numbers than recent years. Stefan Reels is here to break down the current conditions hospitals are seeing.
Well, Pepper, according to the CDC, Tennessee has some of the worst flu-like illnesses rates in the country, joining other states like Alabama, South Carolina, and Washington, D.C. And with cases only expected to rise, doctors are asking all of us to be prepared.
Just actually knowing when that was going to happen was the question mark, and it looks like it's here.
Flu rates keep climbing in Tennessee. Between October 23rd and 29th, Tennessee saw more than 3,000 cases of flu-like illnesses. It's so bad in Shelby County that the health department says right now emergency visits for the flu account for almost 10% of total visits to the ER.
We started to see really an increase in the last 2 to 3 weeks, with a real jump in the last week.
Dr. Nick Highsmith with Le Bonheur Children's Hospital blames the rising flu numbers on the fact we're all more relaxed on taking COVID-19 precautions. According to the CDC, in 2020, this country saw some of its lowest flu rates compared to other years.
We saw a little blip, but we didn't really see too much of that. First winter, while we were in COVID, a lot of the schools were still virtual. We were still social distancing. We were still wearing masks.
Luckily, flu season and RSV season are not overlapping. And Dr. Highsmith says this has helped keep places like Le Bonheur out of bed shortages.
We're really not at that point where we are at a critical bed shortage at this point.
However, cases are still expected to rise.
We should expect probably to see the peak within the next few weeks, I would hope. And then, like I said, it should drop off pretty quickly based on what we're seeing, that we're still going to be pretty high levels of transmission around the Thanksgiving holidays.
Highsmith says one of the best things to do is get vaccinated against the flu, and the sooner the better.
It usually takes 2 to 3 weeks to build up that immunity. So get it now, and hopefully that'll prevent you from getting flu in a few weeks.
Now, if you're still worried, you can always take one of very few precautions to avoid catching the flu. One of the best things you can do is to use similar precautions to COVID-19. Wear a mask, socially distance, and stay at home if you feel sick.